Welcome back. We are going to significantly spend a large portion of our show today on healthcare. And right now it's interesting to learn that our personal healthcare has actually gotten a bit better. I recently spoke with an individual all about a new platform that helps patients and doctors. Let's take a look.
Right now, we are going to focus on how your personal health care has actually gotten better because of the pandemic. Between COVID-19 and diseases affecting millions of Americans, a new platform is utilizing clinical care data to help doctors save lives. Joining us today is Lisa Gurry, Chief Operating Officer of Truveta. Lisa, thanks so much for being here today.
Thank you so much for having me.
So tell us what you have learned about factors relating to COVID breakthrough cases.
Absolutely. We are building a company called Truveta that is an unprecedented data platform for U.S. health. We're able to provide a really new look at how COVID-19 is affecting all Americans, including breakthrough cases of COVID-19. A couple of the insights that we found already. One is that 9 to 15% of people that experience a breakthrough case of COVID-19 end up hospitalized, including about 9% of people that take Moderna and Pfizer vaccines, and about 15% of people that take the Johnson & Johnson vaccine. So unfortunately, that hospitalization rate is something to still be mindful of. And we're finding that people that have high-risk conditions like cancer, for example, are about twice as likely to be hospitalized. So really interesting insights on COVID-19, looking at U.S. data really for the first time at representative scale.
So how does this platform allow doctors to glean this information in real time?
Well, what we're doing is building a platform that pulls together data from 20 health systems from across the United States. So it's representing 42 states, and those health systems have decided to come together to pool their data. We de-identify it, so it's anonymous. And then those same physicians and medical researchers can do a tremendous amount of research using the Truveta platform, looking at that tremendous data set, which delivers them insights that they've never been able to see before in U.S. health. It's essentially a large search engine for health using clinical data and expert analysis.
How do we know that our personal health care data is secure?
We've taken great effort to ensure that patient privacy is protected on the Truveta platform. All of the data that comes into the Truveta platform is de-identified, so it's anonymous. We're really looking for aggregate trends and insights, not individual information. We are very committed to ensuring that patient privacy is protected and secure.
Also, how can this platform affect the future of healthcare?
We're so excited about the potential for Truveta to dramatically improve healthcare in this country. Knowledge really is power, and we believe with more wisdom, physicians will have more information at their fingertips to really explore and understand the best ways to treat patients with any condition. It essentially expands their knowledge set beyond their own personal experience or water cooler conversations to the expertise of physicians all across the country, and able to learn from representative data sets of any type of population. We think this can be a ground-changing opportunity to advance care for every condition, whether it's cancer, Parkinson's disease, multiple sclerosis, or more.
Tell us about how having this technology years ago could have helped your family.
Well, I came to Truveta for very personal reasons. My daughter is 14, and she was born with a range of health conditions, a neurological condition, chromosomal syndrome, and epilepsy. And it took us nearly 13 years to get her diagnosis on her chromosomal syndrome. Even though we live in Seattle with some of the best healthcare in the country, rare conditions are very hard to diagnose. So we have been on a long journey with her to find both the diagnosis as well as the right seizure medication to treat her epilepsy. And we feel very, very fortunate that something like Truveta could help other families learn much more quickly, find those diagnoses much more fast, as well as find the right medications to really help them know how to treat that condition, which would be such a groundbreaking change, both for the patients themselves as well as their families.
And where can we get more information?
We invite everyone to visit our website at truveta.com to learn more.
Well, thank you so much, Lisa, for joining us today. Really appreciate this important information about our personal health care. And thank you for sharing your story and how this impacts you and your family and how can it impact everyone. I appreciate your time today.
Thank you so much. I appreciate it.